Hi, everyone. Let's discuss probiotics in the treatment of IBS. You've likely heard the old saying that health and disease start in the gut. And if that's true, and we'll document this in a moment, then what's going on in the gut could impact your brain, your skin, your joints, your metabolism. So if you're experiencing the symptoms of IBS, gas, bloating, altered bowel function, abdominal pain, that tells you that the preeminating point of where health or disease starts, the gut, could be askew, could be unhealthy. And if probiotics are an effective supplement or support for this, whether from foods or from supplements, then this is huge. So let's use modern science to help us answer the question, can probiotics help IBS? How they might help IBS? And then equip you with a protocol you can use at home, including tips for troubleshooting in case you might suspect certain probiotics don't sit well with you. Welcome to Dr. Ruscio Radio, providing practical, science-based insights into health, exploring the importance of nutrition, lifestyle, and gut health through conversations with experts, research reviews, and personal stories. We break through the bias and the noise to bring you simple, trustworthy information that matters. Now, as I alluded to a moment ago, IBS, irritable bowel syndrome, includes digestive symptoms, pain, altered bowel function. This can be constipation, diarrhea, or an oscillation between the two, bloating or distension, and perhaps also flatulence. But the interesting part of this is we're seeing what's known as extraintestinal symptoms correlate with IBS, meaning depression and anxiety, headaches, dizziness, fatigue, and even poor sleep. So again, there's an opportunity here to really improve many symptoms if we can improve IBS. And also we should ask the question, as we've asked so many times on the podcast in the past, what is the prevalence of IBS? Just so we have an idea. Well, older estimates were clocking in at 10 to 15% of the population. More recent estimates are suggesting it could be as much as 25% of the US population. And by the way, if you don't fit the somewhat narrow diagnostic criteria for IBS, you think you might have it, perhaps your primary care provider, your family practice doctor, your gastroenterologist said, yeah, it could be IBS. You might be in this larger group known as functional gastrointestinal disorders, FGDs, that include things like non-IBS constipation, GERD, reflux. So just something to bear in mind that the FGDs affect up to 40% of the population. So maybe we could say 1 in 2 watching this video or listening to this podcast might have either IBS or a functional gastrointestinal disorder. So let's look at if probiotics can help these. The short answer is yes, but the devil is oftentimes in the details. So let's start with one IBS misconception. Just because an industry has a high level of sales doesn't automatically implicate it in nefarious incentives. The probiotic industry is a roughly $77 billion per year industry. The baby food industry is a $97 billion per year industry. So to say, well, lots of sales equals nefarious intent, I think is a mistake. The more important thing here is the data. The data-driven answer to this, really, BMJ meta-analysis entitled Probiotics for the Prevention of Antibiotic-Associated Diarrhea, a Systematic Review and Meta-Analysis, quoting, probiotics are effective for preventing AAD or antibiotic-associated diarrhea. Now, you've probably heard me say in the past, a meta-analysis is the pinnacle level of scientific evidence. We can argue, oh, maybe the meta-analysis isn't perfect, but at the end of the day, the pinnacle level of scientific evidence is a meta-analysis. And so, 2019 meta-analysis, looking at 11 randomized control trials which protect against placebo effect, comprised of over 22,000 patients. To quote again, There is a general agreement in the 11 included systematic reviews and meta-analyses that probiotic therapy is safe and can be effective in improving overall IBS symptom scores and abdominal pain in general IBS populations. And one more quote, we expect probiotics to be a mainstay of IBS management in clinical practice. That's not all. One more piece of data, a 2020 meta-analysis of 35 randomized control trials, again quoting, probiotics are effective against IBS in terms of both improvements in overall symptoms, abdominal pain symptoms, bloating, and flatulence scores. And I'll just put this up on the screen here briefly, but there was another meta-analysis in 2020 finding the same thing. So to say that there is no evidence is really a violation in my mind of evidence-guided healthcare. It's not to say that evidence in the scientific process has all the answers all the time, but there are many cases where we do. And this is why, just to sort of round this all off, when you look at the evidence-guided model of healthcare of medicine, what you see, the bottom of this pyramid is expert opinion. This is the lowest form of scientific evidence is expert opinion. And the highest form of scientific evidence are systematic reviews and meta-analyses. I think it would be a mistake to represent the body of evidence as having no evidence supporting that probiotics can reduce antibiotic-associated diarrhea and no evidence supporting that probiotics can improve IBS because, as we just covered, there are systematic reviews and meta-analyses to the contrary. If this has been helpful, please support us by liking, subscribing, and especially commenting. I really enjoy hearing the experiences you may have had in the healthcare or medical system regarding probiotics, and I do my best to reply to as many of those as I can. Okay, so as we try to better understand how probiotics can improve IBS, rather than looking at the symptoms to make the diagnosis, so to speak, I think it's helpful to look at what the underlying causes of the IBS can be, because this gives you more precision with how you select what action to take in correcting or supporting the IBS. Now, that being said, as you're evaluating, let's say, a probiotic intervention, your symptoms are crucially important in answering the question, is this the right therapy for me, yes or no? But when trying to understand what's going on in your gut, let's say, here's how I think about this. This 4-factor causative model, if you will. Microbial, lifestyle, dietary triggers, and immune function. Let's outline these a touch more. Coming to the point of microbial, we know that 36% of IBS patients have SIBO, or small intestinal bacterial overgrowth, and 73% of IBS patients have dysbiosis and imbalance. So whether it be too much bacteria or imbalance in the bacteria, this is one fairly prominent cause of IBS. But that's not all. Lifestyle. This is where factors like stress can be very important. In fact, I'm really excited to share with you a study in a moment that demonstrated probiotics can improve the stress response in those who have IBS and depression and anxiety, and also improve mood. We'll come back to that in a moment. Physical inactivity. To quote another journal paper, subjects who were physically inactive were 3.5 times more likely to suffer from IBS than those who are physically active. So just a reminder, if you're not moving, great idea to do so. Dietary triggers. So this includes processed foods, packaged foods, and things like soda. And we'll come to a few more details on that in a moment. That's not the express focus of this video, but certainly I would be severely remiss if I didn't mention diet as one of the triggers of IBS. And most people who have IBS have probably at least suspected that foods can be a trigger. Now, here's one of the nice things, however. Probiotics can improve dietary tolerance. So I look at this as a balance between we want to optimize for the cleanest, healthiest, most nutrient-dense diet, yes. But if there's high degree of reactivity, it might be very difficult to diet your way out of the IBS, or at least using diet as the only tool. And so this is where probiotics can improve food tolerance and allow someone to improve their tolerance and expand their diet without having to go on such a restrictive elimination diet. And then the final point here in this 4-point model is gut barrier function, leaky gut, and the immune system. Leaky gut, as you probably know, is something that we're getting fairly strong confirmation actually does exist. Now, if you went back 5, 10 years, it was more contentious. But now leaky gut, or the more medical term, hyperpermeability of the intestines, is getting, I think, the recognition that it deserves. And here's just one journal paper quote: serum, meaning blood, zonulin, is upregulated in irritable bowel syndrome, and the levels are comparable to those in celiac disease. That's pretty remarkable. And then one more quote on the importance of leaky gut: serum zonulin, so a measure of leaky gut, and LPS, which is what leaks through, allude to tight junction integrity, meaning the cells in your gut should be bound together fairly tightly and not allow a lot of leakage through. So that's the tight junction integrity. And cytokines, inflammation. And this can reflect overall immune system status of the small intestine. So translated, when you have leaky gut, that means things are leaking through as measured by LPS and zonulin, but you'll also see increased inflammation via cytokines. And this can all tell you the status of the small intestine, which is really where most of leaky gut and IBS occurs. Now that we have this 4-component model, microbial, lifestyle, dietary triggers, and immune, how do we use that to better develop a protocol to improve our IBS, reduce our symptoms, and hopefully expand our diet? Let's first go into how probiotics can help correct SIBO and or dysbiosis. And one more time, I want to bring in a thought leader just to equip you with the fact that expert opinion might not always be a highly accurate representation of what the data show. So I'll play a clip and I'll be back with commentary on the other side.
But sometimes, or many times, the probiotic capsule may split either in the stomach or the small bowel. And when it happens, then it is now delivering large amount of bacteria to the small bowel, which inadvertently may contaminate and colonize the small bowel. And now you've created a new problem of gas and bloating because of bacterial colonization in the small bowel. Normally, small bowel does not have any bacteria. But if you get this, then you've taken probiotics that have inadvertently caused harm.
Okay, so I really appreciate Satish Rao. He's been on the podcast, I believe, 2 times in the past. Enjoyed our conversations. I think the research he's doing is valuable. But the perspective here, I think at least maybe has shifted over the past few years in terms of 5+ years ago, you could have maybe made the argument that if you get probiotics into the small intestine, that's going to be a problem. Now, the context here is that there are bacteria in the small intestine. There's just less than when compared to the colon. And this is because the flow of food is from the stomach to the small intestine to the large intestine and then out the rectum. Since the stomach is highly acidic and you become less acidic as you go from the stomach to the large intestine, less acid means more bacteria can grow, or more acid being antibacterial, equals a lower level of bacteria. But this doesn't mean that probiotic supplementation is bad for the small intestine. What evidence do we have? We need to have outcome evidence in humans to answer this question. If not, it's just conjecture. It's just expert opinion. So enter a 2017 meta-analysis of 18 studies. To quote, the SIBO decontamination rate achieved with probiotics alone was 53%, which was comparable to that observed in a meta-analysis of antibiotics at 51%. So very clear and very compelling data that probiotics actually exert quite beneficial impact on the crucially important small intestine by decontaminating SIBO with an efficacy rate similar to that of antibiotics. Not only that, this next trial I wanted to share with you, I found to be one of the more compelling evidence point in this regard in the past few years. Clinical trial, and they're comparing the effects of probiotics on people with IBS symptoms who have SIBO compared to those with IBS symptoms who do not have SIBO. And what this graph is showing is that in those without SIBO, they saw an 11% improvement in their symptoms. Whereas if you had SIBO, there was a 71% improvement in your symptoms, likely because those who had SIBO or overgrowth and then took the probiotics had a decontamination of the overgrowth and therefore a better response in their symptoms. So what these data, at least in part, tell us is you want the probiotic to have an effect in the small intestine, to open up in the small intestine, because you'll have, at least according to this one study in the meta-analysis, better results if you impart probiotic effect in the small intestine. And here's part of the reason for that. The small intestine, as we've covered before, but just as a quick recap, small intestine, 22 feet, large intestine, 5 feet. Small intestine, 90% plus absorption of calories and nutrition. And this is also where leaky gut predominantly occurs. Whereas the large intestine, little to no leaky gut and little to, I shouldn't say no, but very little in the way of caloric or nutrient absorption. So really, the small intestine is crucially important. And this is why we want to be exerting benefit there, at least from a data-driven perspective. We start with the data, and then we can sort of reverse engineer what mechanisms or what physiology, right? Rao's claim was, well, since there's less bacteria in the small intestine, we don't want probiotics to get into the small intestine. Well, that's all interesting. We could counter-argue and say, well, since probiotics have direct antibacterial and antifungal action, and they improve leaky gut, we probably want them to have action in the small intestine. So there's the argument. Who wins the argument? Whoever has outcome data showing that people have a better response from either using probiotics or avoiding probiotics. And I think the case is pretty clear here when we look at the meta-analyses that people benefit fairly remarkably from using probiotics because they have a beneficial impact on the small intestine. Okay, so let's continue to dysbiosis, because it's not just about overgrowth. It's possible that your levels are fairly normal, but the balance is off, is askew. So enter a 2023 meta-analysis, probiotics versus control. They found that probiotics reduced dysbiosis by improving levels of lactobacillus and bifidobacterium. Also, don't forget that you can obtain probiotics from food. A 2020 systematic review found that probiotic food consumption improved dysbiosis and improved IBS symptoms. Okay, so let's come to another component. We went over microbial. Now let's go over lifestyle, stress, and I think the most important factor here, maybe the most important, it depends on the person, I suppose, is this brain-gut connection. This was a fantastic study from 2023, just this year, published in Neurogastroenterology and Motility. They gave probiotics to IBS patients who also had either depression or anxiety. Now, here's what's interesting coming to this diagram. They found that people with anxiety or depression plus IBS, they didn't have an appropriate release of cortisol. This is known as the cortisol awakening response. When you wake up, you should have cortisol release. So you get up, you get out of bed, you get on with your day. This is a hallmark of healthy cortisol output. You don't want high cortisol when you're trying to go to bed. This can cause insomnia, but you do want this robust cortisol awakening response. So the people with IBS and with anxiety or depression had a blunted, a low, a abnormal level of cortisol in the morning. When they supplemented with probiotics at week 4 and week 8, they saw a normalization to near that of health controls of their cortisol response, their cortisol awakening response. And here's the kicker, two kickers, right? There was also an improvement in IBS, an improvement in sleep, an improvement in mood, along with this normalization of the cortisol awakening response. So this is great. I don't want to blow past this. Again, those with IBS and low mood took a probiotic. They had improvements in their IBS, improvements in their depression and anxiety, improvements in their sleep, and a normalization in their cortisol levels. But here's what I found to be really fantastic or really interesting. After 2 months, they stopped using the probiotics and they saw a regression of their cortisol levels in a negative fashion. One of the things that we've been trying to chronicle over the past several months is this emerging trend we're seeing in the probiotic science that 2 or maybe even 3 months or perhaps a touch longer might be needed to see the optimal response. Now, it's not to say you have to wait that long to notice benefit. You should notice benefit perhaps within a month. But as this data set are articulating, improvements were seen at month 1, at month 2, but when they stopped at the end of month 2, they saw a regression of their symptoms. So this at least tells me, or how I interpret this, is they may have needed the probiotics for 3, maybe even 4 months. So the simple rule of thumb here is use a therapy until you hit noticeable improvement that's been consistent for at least a month. Then try coming off that support. By the way, always check this with your healthcare team because this doesn't apply to everything. It's just a general heuristic. Wean off the therapy, see if you maintain your improvements. If you do, awesome. If not, that indicates that you probably haven't yet had enough support to maintain balance. And I always use this crude analogy, pardon me if it's a little bit redundant at this point, but if you sprained your ankle and you were doing a PT program and the PT said, okay, now you have this maintenance program that's working. You stop the maintenance program and then a month later, your ankle starts to get sore. You would say, oh, I probably need to do the maintenance a little while longer. I'm not quite ready to come off the maintenance program, right? So that's how I think about this. Okay, so let's move on to dietary triggers. There are some basics. Processed food, added sugars, added emulsifiers. Most of these things you will take care of if you just eat whole, fresh food. Doesn't matter if you're doing more of a paleo or Mediterranean or higher carb or lower carb or even plant-based. Without getting into all the nuances there, there's one diet I did want to point out because it's not factored into improving your diet quality. And this is low FODMAP. High FODMAP foods are ones that are high in prebiotics that feed bacteria. So think cauliflower, broccoli, avocado, apples, stereotypically healthy foods. However, if you have imbalances, these foods seem to be, at least for some people, a trigger. So if you've improved your food quality and you're still noticing symptoms, you may want to try a low FODMAP diet. Enter a 2022 meta-analysis, 13 clinical trials were summarized. People who went on a low FODMAP diet saw improvements. And to quote, the low FODMAP diet ranked first for abdominal pain severity, abdominal bloating, or distension severity, and bowel habits. Okay. And if you want to see a more thorough unpacking of the ways through which the low FODMAP diet can heal the intestines, check out the video that we released on this maybe a month ago. And then the final component of what probiotics can do to improve the health of your gut indexes to leaky gut and immune function. This paper was fantastic, hot off the press this year, documenting that probiotics can resolve leaky gut. And this was a good study, a meta-analysis of 26 randomized control trials. They found that probiotic supplementation can reduce leaky gut as evaluated by serum zonulin, blood zonulin, and by LPS, direct particle leakage being measured. And you would correspondingly expect to see improvements in inflammation, which they did document vis-a-vis reductions in C-reactive protein, TNF-alpha, and interleukin-6. And that is what you're seeing in this diagram, where the probiotics help to restore microbial homeostasis, so that's the sebum dysbiosis, leading to reductions in endotoxin and LPS particle leakage, reductions in inflammatory cytokines, and a reduction in serum zonulin as the gut barrier heals. Now, remember, the claim from Rao was that the probiotics could do damage to the small intestine. Understandable speculation or theory or hypothesis, but the data now are so compelling that I feel that that sort of thinking needs to be revised. Again, given this paper that was just published this year, teeing up for us in a meta-analysis the conclusion we should be deriving regarding probiotics for small intestinal health and for leaky gut and for immune function. Okay, so now that we've examined all of the physiology and all of the studies, how do we put together a protocol? The challenge here is that there are a ton of randomized control trials that we just covered across all those meta-analyses, summarizing 5, 10, 15, 20 randomized control trials, each randomized control trial often using different dosages and different formulas. So as we've been studying this body of literature for a while, this is the meta protocol that we've put together based upon how you could summarize these data. Now, the other point here, let me just pivot over to this. So when you take a big picture view on probiotic research, you see that probiotics tend to fall into one of three types: blends of lactobacillus and bifidobacterium. This credits partially to Mechnikov, who was traveling in Bulgaria and noticed that villagers who were consuming fermented milk had a longer life expectancy. So that's your lactobif, sort of your dairy-ish probiotic. They don't all contain dairy, but that's your lactobacillus and bifidobacterium blend. If you look on the label, you'll see various lactobacillus and bifidobacterium on the ingredient label. The second is Saccharomyces boulardii, discovered by Henry Boulard, Indochina, 1920s. During a cholera outbreak, everyone had diarrhea. Boulard looks around and notices, some people who are consuming a certain fermented tea do not have diarrhea. Later he finds out that that tea that protected against the cholera-induced diarrhea contained Saccharomyces boulardii. And then thirdly, soil-based probiotics borrow from the fact that contact with dirt and the microbes in dirt can have health benefit. So this is where the three different categories comes from. And that's the basis for understanding the protocol and also for troubleshooting. Firstly, your target dosages are going to be for the lactobifidal blend 1 to 10 billion as a minimal effective dose, although higher is okay, for 2 to 3 months. The Saccharomyces, 10 to 15 billion per day, again for 2 to 3 months. And the soil-based probiotic, 2 to 6 billion per day, again for 2 to 3 months. Now, regarding troubleshooting, once you have this framework for the three different types, if you have reacted to probiotics in the past, you can now look at the label and identify what you've reacted to as one of these three, and then trial one of the other two. I have never seen someone, I should never say never, but it is incredibly rare that someone, even the most reactive individuals, can't tolerate at least one probiotic formula. But you need a framework to be able to look past the name and dissect the ingredients and understand what the different ingredient labels will tell you. So take that into your experimentation, and whichever one you tolerate, stick with that one. If you want to do a very robust protocol, you can trial all three. This is what we do in our consulting practice. This hasn't been published yet, although we're hoping to publish on it. Essentially, very simple thinking, a rationale behind this. If one probiotic is helpful, might 2 or 3 be better? Again, not published, but borrowing from a fairly impressive body of data showing that when someone has an infection, more than one antibiotic, or some herbal research showing that more than one herbal antimicrobial seems to be more effective than just one alone. So again, I want to be careful that this is our clinical observation, but there's some anecdotes that are, I think, fairly promising here. And again, hopefully within a year or two, we'll be able to publish something that's randomized to support this. If nothing else, this gives you a troubleshooting protocol so that if you have had reactions in the past, you can now hopefully work around that. Because again, I've seen almost no one who can't tolerate at least one of these formulas. And the final point here I wanted to make is not to forget about probiotics from foods. This table, as I've shared in the past, it's a little bit busy, but the main thing I'd like to point out for you here, and what this table is showing for those just listening, a probiotic supplement that's a blend of lactobacillus and bifidobacterium with the constituent species and the dose compared to different foods: sauerkraut, yogurt, kefir, kimchi, and kombucha. And what you see is there's quite a bit of similarity in terms of the types of bacteria in the supplement as compared to the foods. And the dosages are also fairly similar. You can get 1 to 50 billion per serving in most supplements. And with these foods, as you're seeing, you can get 14 billion, 170 billion, 250 billion, 1.5 trillion, 2.4 billion, or less, depending on how concentrated the foods are. But 2 points to make here. One, don't forget about the importance of fermented foods. And then 2, that you can get a pretty decent dose from foods, and therefore it doesn't mean you must use supplements. Some people can be reactive to foods and some of the components in food. So if you've noticed that, this is where I think a probiotic supplement, at least early stage, until you become more tolerant, makes sense. Okay, well, that is a fairly thorough review of probiotics for IBS. And hopefully you now appreciate that, yes, there is compelling data when we get away from expert opinion, albeit well-intentioned, and we look at the hard science, the data, we see good support for probiotics in IBS. There is a model that I like to think about IBS through, which is microbial, lifestyle, dietary triggers, and immune. And as we've discussed, there's evidence showing all of these components can be improved from either changing your diet or supplementing with probiotics. And that food is a great place to start, not only for reducing your triggers dietarily, but also for obtaining probiotics from your food. And then supplements are a great adjunct if you're reactive, if you don't care for sauerkraut, kimchi, kombucha, or if you're just looking for the convenience of a probiotic supplement. All right, guys. Well, remember, if you do have IBS, lots of options. Hopefully this helps you on your path.